Surgery is a common treatment for breast cancer. There are a number of surgical techniques, and your doctor will help you decide which is best for your situation. In addition to removing breast tissue, it may be necessary to remove some or all of the lymph nodes under your arm. Before the procedure, an intravenous line will be started, and you may be given an oral sedative to help you relax. Surgery for breast cancer usually requires general anesthesia. A breathing tube will be inserted through your mouth and into your throat, and you will be given medications to put you to sleep for the duration of the procedure. Depending on the type of procedure, breast cancer surgery usually takes between 1 and 3 hours. The main surgical procedures are lumpectomy and mastectomy. In a lumpectomy, which preserves the appearance of the breast, your surgeon will incise the skin with a scalpel, separate the tumor along with a margin of healthy tissue from the surrounding area, remove the mass from the breast with forceps, and send it to the pathology lab for examination. Your surgeon will then close the wound with sutures. In a mastectomy, the entire breast is removed. This is usually indicated when the tumor is too large for lumpectomy. In a simple mastectomy, only your breast tissue is removed. Your surgeon will make an incision along the length of the breast. Separate your breast tissue from the muscle underneath and remove it for examination. Before closing the wound, your surgeon will insert drains to prevent fluid from collecting. The most common type of mastectomy is a modified radical mastectomy, in which the entire breast and some or all of the lymph nodes under your arm are removed. In this procedure, your surgeon will make an incision along the length of your breast, separate your breast tissue from the muscle underneath, and remove it for examination. To remove the lymph nodes under your arm, many surgeons use a technique called sentinel node biopsy, in which dye is injected into your breast to determine which lymph nodes drain fluid first. It is these lymph nodes that are most likely to contain cancer. Your surgeon will remove 1 to 3 of these nodes for examination, insert drains, and close the wound with sutures. In a radical mastectomy, the breast, adjacent muscles, and lymph nodes are removed. Your surgeon will make an incision along the length of the breast. Separate the entire breast, underlying muscle, and all visible lymph nodes from the chest wall, and remove them for examination. Finally, your surgeon will insert drains and close the wound. After the surgery, your breathing tube will be removed and you will be taken to the post-surgical recovery area for monitoring. Lumpectomies are most often done as outpatient procedures. In this case, you will be able to leave the hospital after several hours. Most inpatient procedures require at least 1 or 2 additional days in the hospital.